Hi and good morning everyone. My name is Aimi Farhah and this is my partner.
Husna Inani.
Today we are going to present about one of major health issue in Malaysia, which is cancer. Cancer is a serious health condition in Malaysia with over 51,000 new cases reported annually. That's a huge number and it affects families, communities and the entire healthcare system. According to Health Minister Zulkifli Ahmad, based on Malaysia's 2023, cancer is one of the top causes of death in both private and government hospitals.
Okay, so what is cancer? Cancer happens when abnormal cells grow uncontrollably in the body. These cells can spread to other areas, causing more damage. According to Globocan 2022, the most common type of cancer in Malaysia are breast, colorectal, and lung cancer. So, the problem is many cases are detected too late. This delay, along with a lack of awareness, causes high death rates, especially for lung and liver cancer. So, cancer also has a big impact on mortality, the quality of life of patients, and it puts stress on our healthcare system.
So today, we want to highlight that breast, colorectal and lung cancers are not only the most common, but also the deadliest types in Malaysia. So let's look at the chart. Okay. This is the pie chart. This pie chart shows the number of new cancer cases in 2022, including both men and women. The top 5 cancer types are listed along with the total number of cases, which is 51,650. Okay, so the first ranking is breast cancer, which is 8,371 cases or 16.2%. So for the second rank, colorectal cancer is 7,150 cases or 13.8%. So for the third ranking is lung cancer, which is 5,503 cases or 10.7%. For the fourth ranking is liver cancer, which is 2,360 cases or 4.6%. For the last one, which is 5, prostate cancer, 2,360 cases or 4.6%. And the rest falls under others, which together make up 50.2% of all cancer cases. That shows there's a wide variety of less common but still serious cancer. Breast cancer is clearly the most common, making up more than 1 in every 6 cases. Colorectal and lung cancers are also major contributors with over 24% combined. Interestingly, liver and prostate cancers are both making up 4.6%. The large others category tells us that Malaysia also faces many other cancer types, which may be rare but still dangerous for us.
Okay, so next, let's take a look at chart 2. We can see a clear pattern in how cancer incidence rates change with age in Malaysia. So, the chart shows that the rate of cancer begins to rise steadily starting from the 40 to 44 age group, and the increase become much more significant after the age of 60, peaking in the 75 and above age group. Okay. This indicates that age is a major risk factor for cancer development. When we look at gender differences, the data reveals that females aged 25 to 64 had a higher rate of cancer compared to males during the period from 2017 to 2021. This trend is similar to previous years, suggesting a consistent pattern. Okay. However, the situation changed after the age of 65. At that point, male cancer incidence rates become higher than those of females, highlighting a shift in risk as people age. These findings are important for several reasons. First, they show the importance of age-specific and gender-specific cancer prevention strategies. Middle-aged women may benefit from target screening and awareness program, while elderly men might require more frequent checkup and monitoring due to their higher risk later in life. So the second is, this data highlight the need for stronger healthcare support for the aging population. As the number of older adults in Malaysia increase, the country must prepare for a growing cancer burden among seniors. This includes improving access to early detection, diagnosis, and treatment service for older individuals.
So, we are already at the last part. To conclude our presentation, the data clearly highlights the rising cancer burden in Malaysia, driven largely by factors such as age and gender. Cancer risk is not the same for everyone. It's different based on age and gender. We have seen that breast, colorectal, and lung cancers are among the most common and deadliest types. The statistics also indicate that cancer incidence increases significantly with age, especially after 65. Additionally, females aged 25 to 64 tend to face higher risk compared to men in the same age group, although men experience higher rates after age 65.
Okay. This growing trend highlight the urgent need for action. So, the reducing the future burden of cancer in Malaysia will require effective healthcare planning, improve earlier detection strategies, and strong community education initiatives to raise awareness. Lastly, by addressing these key issues now, we can work toward lowering cancer mortality, improving quality of life, and strengthening our healthcare system. So that's all from us.
Thank you for listening. Thank you.
Thank you.